Hey guys, today we have Joel who's come in with a little bit of knee pain as he's been ramping up his running training over the last month. So Joel's been doing about 30 Ks a week, and over the past sort of week or so, he's actually started to increase his pace to try to pick up his speed and get a better time throughout his runs. But as he's been doing this, he's started to notice pain on the outside of his left knee. We've gone through all his orthopedic tests and muscle tests and found that he's got an ITB syndrome causing this pain. So today what we're going to go through is work through all the tissues that are leading to that pain, which is going to be the ITB, the outside of the quad, and up into the hip itself, which has a lot of control around stability of the knee. Release all these tissues so we can take the pressure off that and get him back to running comfortably again. So Joel, to start with, what we're going to do is we're actually going to get you laying down on your back. We'll do that now. And we'll work just with a broad, soft tissue release through the bulk of the ITB muscle. So what I like to do for this, I use my palm to sort of stretch that fascia down as we then traction the leg across. You'll feel like a pulling through right from the knee down to the hip with this one. That's not causing any pain at the knee though. That's all good. Cool. Find this is a really good way just to get some broad, soft tissue release before we get really stuck into some of these tissues. All right. So generally with ITB syndrome, what I'll see is a lack of control around the hip, especially with people ramping their training up. And that causes like the leg just to sort of adduct, come in towards the midline just a little bit. And that'll create like a shearing force as that sort of drops in with each step. And that, as you push off, if it's dropped in a little bit, you'll load up the outside of the quad. So that's the next muscle we're going to sort of work into. So Joel, what I'll get you to do is sit up for this next one and coming just to the edge of the table. So we're going to keep that leg straight to begin with. And it's grip into the vastus lateralis, the outside part of the quad. Hook into there, and Joel, you're going to bend that leg all the way and grab the ankle and sort of tuck that up. And that's going to release that muscle and all the fascia running through there, as well as some of the ITB as well. So we're going to do a bunch of passes on that one. How's that feeling? Yeah, it's pretty brutal in there. Good, let's go. We're going to do a few passes here. Yeah, that's pretty rubbish. No wonder you're getting that knee pain. Good. And again. Good. Last one for me. Yep. Great. So now that we've taken the tension out of the outside here, because Joel's probably been dropping in while running, we're going to see some tension in the upper part of the adductor. So we want to make sure that's corrected so that we sort of don't see that continually pulling in as he runs. So laying down on your back again. Now there's multiple parts to the adductors, but I find the most effective for treating this injury is sort of the bulk of the adductor belly here, which is the adductor magnus. Good. So the adductor magnus will often help out with a lack of sort of glute control. The adductor magnus will initiate that pushing off phase as you're running in hip extension. Let's get one more pass. Great. All right, next we're going to do a combination of both the quad and the ITB as well. So Joel, I'm going to get you laying on your side for this one. And maybe shuffle back just a tiny bit towards me. That's good there. So active release technique again. We're going to tension up that quad and stretch the quad muscle. Once we get to around that end range, then I drop it down to get stretched through the ITB as well. Good. Letting that knee go. Good. There we go. That's brutal in there. Let's go 2 more passes, I think. Away. Last one there. All right, now that we've taken all the tension out of the quad and the ITB, the next step is to really deload any sort of tightness that we're seeing up in the glutes, the TFL, because that fascia will run down the leg into that sort of part, pulling on that knee. So glute med to start with, what I'm going to do is I'm going to take that from the sort of iliac crest where it attaches down the leg, get that tension, and then Joel, you're going to bend that knee up towards the chest. Great, and you'll bring it all the way back. We'll do a few passes through here, take all that pressure out of that muscle. Good. Yep. Good. Yep. Great, let's get one more pass on that. Yep. Good. Okay, so that sort of hits the back part of the hip. Now I kind of want to get into the front a little bit, and that's the TFL, still on the edge of the pelvis here. So Joel, you're going to help me with this motion. What we're going to do, starting with the leg there, straighten, lower it down as I work into that small muscle there, okay? Holding there. Yep, let's go. Great. How's that feeling through there, Joel?
Yeah, that's good.
Yeah, good. Again. Let's go 2 more passes. Yep. Good. Last one there. Yep. Good. All right. Next step, now that we've sort of cleared out those muscles that feed into the fascia of the ITB, I want to work on the ITB a little bit more because we've sort of gone quite firm, but I want to sort of bring it into a superficial layer, and we're going to do some scraping to sort of work that, okay? Okay, so the first step when we do the scraping is just to sort of get that balm on there so we're not sort of too abrasive on the skin. Once that's on there, I sort of feel for where that fascia gets restricted. And for Joel, it's definitely more as I come up the leg through this part here. It's almost like a gristly sort of feeling. So we're going to work into that a little bit more. And we'll just sort of retest. That's already cleared out a fair bit there, but I can feel some more at the back of it. So we'll just get a little bit more balm on there. Just keep working into that. Great. So we'll just keep that short and simple for that, because if you get too aggressive, you'll see those people that get bruising all over that. And really, I don't think that's very good for the healing rates. We just need to get what we need to get and then leave it alone. So the next step I want to do is to change that inflammatory response that he's getting. We're going to do some needling at that ITB attachment at the knee, up through the quad where we're finding that really tight, and then up into the hip to address all those tight muscles through the glutes there as well. All right, so let's start. We'll get those needles down at that ITB attachment point. So one of the ITB attachment points is above the knee, one's just below, so we hit it in 2 positions there. And we'll take it up through the belly as well. Little twitch from that one, which is good. It's a sign that the muscle's releasing. And then we'll get a couple into the vastus lateralis just through here as well. That was another nice twitch. Good. Now they're in, we'll move up towards the hip. Start with one just at the top of the TFL there. Good. Moving around into that glute medius. Just one more. Another good twitch there. Definitely needed these needles. All right, so we're going to let that sit there for a few minutes now. Now that they've sat in there for 5 minutes, we're going to take these out. But if you guys have ITB or knee injuries yourself, feel free to comment below and I'll sort of help you out with your injuries if you'd like. Or otherwise, feel free to subscribe because that'll help the channel and help me get some more content out to you guys as well. And now for Joel, what he needs to do over the next couple of weeks is probably dial back and sort of do some load management. I think he can still run. We'll stick to flat surfaces for the moment and probably peel it back from 30 kilometers to 10 to 15 and peel back the pace to the old pace he was doing. Once he's then able to build up to 30 kilometers, we'll make a plan to be able to start pushing that mileage and getting some faster run times going. But I'll see you next time, guys.